relational approach to advanced care planning. We know that family and informal caregivers specifically have a really important role in dementia. Both of them highlight also that for family, doing advanced care planning has emotional benefits. It was really striking for us. It's not only family carers that say, yes, this provides more peace of mind for me if the person can't make a specific decision. I would feel better that I knew what he would have wanted. That's an emotional security for the family. But the person with dementia actually highlights that also. For them, how others feel, how their supporters or their carers feel is essential. So often they start this process because of the family. They highlight that as a facilitator, as a reason why they do that. Because for them, living in the moment, that's often set as a barrier. They don't want to project to the future because they want to live and enjoy every moment. That is the case, but they also don't want to burden their loved ones. And that is a real opening, I think, to discuss advanced care planning and their feelings about that. It's also a bit strange that sometimes we feel that a person, an individual, takes a decision and we don't necessarily take into account that every decision in everyday life is made with the influence of another person. This is really basic psychology, you might say. There is not any decision that is not influenced. You can, of course, directly influence people, but usually influences are not that visible, they're indirect. And so in that sense, the relational autonomy principle, which you find in ethical literature more, really applies here. Sometimes people address relational autonomy as the opposite of autonomy, because they feel that an autonomous person, that's an individual who can make a decision on his or her own. But I don't agree with that. I think relational autonomy is also a form of autonomy. It means that I, as a person, find another person important, and I want that person to be included in my process. And it's the opposite of individualistic thinking, I think, but not of autonomy. And so this is a paper from an ethicist and some colleagues in KU Leuven in Belgium who wrote a paper on the history of relational autonomy and how it actually started as a movement, kind of like opposite, you might say, from the autonomy movement, but actually I don't think that it's that different. It's just seeing a person as a human being with social relationships. So I feel that those two things should be combined. So there is a need, in my view, when we talk about advanced care planning, for a person-centered but also a family-focused approach, the combination. And we need to support people not only in professional conversations, but also outside. We know people talk to each other. They say a lot more outside of the professional context than within. And this is what was said by a person with dementia. It's not an easy discussion to have with your family. It's a tough discussion. It's a discussion that will trigger a lot. There was a lot of tears. Or a supporter said, there should be more guidance on how we discuss this with our family. Our daughter was 14 when my husband was diagnosed. So if you read this, you immediately get a lot of triggers, I feel, about the need to support people in these difficult conversations. And that's something else than tick box exercises with non-treatment decisions, what you want or not at the end of your life.